Thank you very much, Senator Udall.
Thank you, Mr. Chairman. Thanks to you and the ranking member, Senator Corker, for holding this important hearing. I think this discussion's been very, very helpful on a macrocosmic level. I've got a couple questions that are a little more focused, but before I turn to those, I wanted to acknowledge that, Dr. Chernoff, I think you're sitting between those two advocates on either side intentionally. Chairman Cole and Chairman Corker are very astute staffs, and but thank you all for your great and spirited conversation. Mr. Coleman, let me turn to you and follow up a little bit on what Senator Manchin pursued, and with a particular focus, and I'm going to turn to Dr. Fader as well, on rural parts of the country. In Colorado, we have, of course, the eastern reach of our state is very rural. We produce a lot of food and fiber and fuel for the country. We also have western reaches in Colorado that are very rural. What have you found are some of the unique challenges in providing those long-term services into those parts of your state? And then, Dr. Fader, I'd like you to maybe follow on with how Medicare itself could work with that dynamic.
Again, well, Minnesota has greater Minnesota also, where the population density is certainly a challenge in providing services to older adults and people with disabilities. What we found, though, is that we need some flexibility. Again, relying upon the communities and the community infrastructure with which to base long-term care services and supports. We need to acknowledge the drive time, the differences that we need to accommodate in our policies to allow for people to have some choice, but they may not have as much choice. It's a challenge to devise policies that accommodate those kind of distinctions or differences, but it can be done. We're also learning the value of technology. And the fact that every day there's more to be learned from how we can support people in their own homes with the use of technology via the internet, via other lifeline-like systems and monitoring systems for people who are some miles away from services.
Dr. Fader, would
yeah,
you follow on?
I would reiterate that, and I think reinforce the emphasis on technology to connect people to who are dispersed to resources that can serve as supports and can have people who can check in on people who are impaired and be able to. I mean, Skype is a wonderful thing, and I'm sure we got better than that. But there are, I think, mechanisms that can make people feel connected and supported and keep them connected to caregivers who are more likely to be caregivers, by which I mean medical technicians in urban areas. But you asked about Medicare. I think that Medicare, in terms of developing integrated delivery systems, and I think Medicare is in the process of doing this. We need not look to states. Medicare, or we need not look only to states. Medicare can do a great deal and is in this regard. That by trying to support physicians' practices that are small physician practices in rural areas, and using personnel who can serve several practices as care coordinators, who are able to connect using both visits and technology to people who are in their own homes and enable them to connect to resources for supports. I think Medicare can do a lot in that regard.
So you perhaps could be making house calls using technology without actually being on site.
I'm confident it's not exactly the same, but I think you could greatly enhance support for people, both in terms of monitoring their conditions and in terms of helping them keeping track of people so that you know when a crisis is occurring. And that's what coordinators, what we're looking at with social workers and nurses and other professionals to help identify when people need interventions and try to connect them to the resources, the infrastructure we're talking about, that Bruce is talking about building, so that they can stay at home, so it doesn't become a crisis and we don't have an unnecessary hospitalization.
Both my parents were very stubborn. I'm sure I won't be stubborn, and my children will think I'm very flexible. But they both wanted to live in their own homes in their later years. Imagine that. And they both took falls when there were not people there, and both of them lay in the bathroom and kitchen, respectively, for half a day or longer. And then the result of those falls then ended up in their deaths ultimately. And that, I wonder if there couldn't be that sort of monitoring that, although you have privacy concerns and so on, but
we can do way
more.
better. I don't think there's
Yeah.
any question about that. And you think about things that cause unnecessary hospitalization like dehydration. So having
Yeah,
somebody
that-
checking in on you that you're eating properly, taking your medications, all those things can very much improve quality of life and quality of care for people and prevent the use of expensive services.
yeah, that dehydration actually contributed to the conditions both my parents developed. Let me go back to, if I might, long-term care insurance. I know Dr. Holtaken, you spoke to this. I know I've got my little pamphlet that the FHEBP has sent me sitting in my home office suggesting I ought to buy a long-term care insurance. I haven't responded yet. I keep thinking, well, I'll find a moment where where I want to do that. Mr. Bryan, I know that in the federal program we have one long-term care insurer, I think. Is it John Hancock? What are you doing to think about attracting more carriers? And then if there's a little bit of time left, I might ask Dr. Holtz-Aiken how we further use market forces and market psychology to get us to aging baby boomers to participate.
Yeah, I actually think you've identified one of the challenges that we see for the federal long-term care program going forward, is that in recent years, the number of insurers who are actively participating in this market has gone down. I'm not so concerned that we have one provider of the long-term care program right now. I think that for the way we've done it, that's the way we do life insurance, that we want. It's not like the health insurance where people are changing yearly. What I am more concerned about is that when we re-upped our contract, we only had one active bidder to provide that service. So we are looking very carefully at the moment we have a provider, it's doing a good job, but a concern long-term for this program is that there are enough active participants, insurers out there trying to actually provide that service. I think the point was made earlier today is that the market has stayed relatively static over a number of years, and it's not growing rapidly. We are very happy in the fact that with our most recent, when the contract opened up again, that we actually increased the enrollment by roughly 20%, which we thought was very positive, but it is one of the challenges on the horizon for us.
I could help those numbers if I'd sign up.
You can sign up anytime. We can get you.
You can do it in the hearing.
Doctor, would you any further observations?
I think it's very important to harness market forces literally from the ground up. And I think you've heard talk of the technologies, you've heard talk of the need for flexibility, and markets are very, very good at that. There are roles for government in this, and they are on both sides, both good and bad. I mean, you care about privacy. You care about having quality personnel going into someone's home and delivering services. But if you regulate too tightly what a person can and cannot do, then you're not going to get the benefits of bundling the different kinds of services. So a thorough review at the ground level in every state about the ability to provide these services more cheaply is going to make the care cheaper, and that's going to help make the insurance cheaper. And you just can't get around that. And having a very expensive underlying care makes insurance a lot harder to sell. And then, you have to be able to make money or you're not going to stay in the insurance business, and that's bodies. And I think we've had too little awareness and too little education for people to sign up. There's an old saying that said insurance is sold and not bought, and we might need to sell more of this. And so I think that's a big part of it. And to the extent that the experience of the boomers in caring for their parents drives this. I think that's one thing we might see be very different in the future than in the past.
Thanks again. Thanks to the chairman. And I think President Clinton once remarked, this is a high-class problem we have because of the extension of our lifespans, but nonetheless, it is a real challenge. So thank you all. Thank you.